CBS 17 News, tracking coronavirus.
We will emerge from this pandemic stronger than ever, and we all want to do it as soon as possible. So let's do it together.
With hospitals and emergency responders overwhelmed, the state is looking for more help. Good evening. Thanks for joining us. I'm Angela Taylor.
And I'm Rod Carter. Glad you could be here. They're asking FEMA to send ambulances to North Carolina to help with administering monoclonal antibody treatments. Our Capitol reporter Michael Hyland live in Raleigh for us tonight with this story. Michael, this is also happening as EMS agencies are dealing with shortages and record numbers of calls.
Right, and I asked Governor Cooper about that today. We got some new information about exactly what the state is asking for, but FEMA has not given the green light just yet. In the battle against COVID-19, North Carolina leaders are turning to the federal government. They've asked FEMA to send 50 ambulances and 100 people to staff them to help with administering monoclonal antibody treatments. Those can help people dealing with mild to moderate symptoms if administered within 10 days of infection, potentially keeping them out of the hospital.
We want even more places that we can do it. FEMA offered to try to help states.
If FEMA approves, documents we obtained show the teams would go to 7 locations across the state, including Durham, Mecklenburg, and Pitt counties, among others. It's not clear where they would come from.
Resources are strained, and so when FEMA offers help, we say yes, there are certain places where we have asked for additional help related to ambulances and personnel.
Dr. Mandy Cohen said the state is also trying to get help to deal with a shortage of EMS workers as agencies report simultaneously getting record calls.
We are typically, on average, probably down about 10 units a day.
Help is coming, but for those who are calling with a lower priority issue, may not get there as quickly as what they would like.
When I contacted FEMA, a spokesperson said nothing has been approved yet, but that the agency is committed to working with the state. Amid concerns about the supply of the antibody treatments, our neighbor Tennessee is actually recommending that they be restricted to those who are unvaccinated or at the highest risk. Here in North Carolina, they're not taking any steps to restrict access to the treatments and said our supply is actually increasing. Live in Raleigh, Michael Hyland, CBS 17 News.